Okay, 10 seconds. 10 seconds. That Barack Obama? No, that's not Barack Obama.
Are at a White House forum to discuss efforts to combat HIV and AIDS. This event comes on the eve of tomorrow's World AIDS Day. It's 30 minutes.
No, it's 33 minutes and 45 seconds. 33 minutes and 45. It's 33 minutes and 45 seconds. It's technically not tomorrow. Remember that one time I said I'll do the AIDS thing tomorrow? I didn't quite do it tomorrow. It's Thursday, September 18th, 12:38
Members of the
p.m.
President's Cabinet, members of Congress.
How good's your memory, right? I hope somebody has a pen. Oh my god.
Ladies and gentlemen.
Oh my god. Did you just zoom in?
And good afternoon.
Crap. One second.
We're here today on the eve of World
zoom
AIDS
out,
Day
zoom
2009
out,
to
zoom out.
commemorate this important day on all
Wait a second,
Congressman Gail Smith.
No, zoom out. Stay zoomed out. Stay zoomed out. Thank you, camera. Stay zoomed out.
Joining us in the audience is also Gail Smith. Gail is a special assistant
That's an order.
to the President and Senior Director for Development. To be after all around the country, he'll give the closing word.
There you go. Okay, zoomed out. Zoomed out. Finally, zoomed out.
The President's commitment to fighting HIV/AIDS is personal.
It's called lenacapavir. This thing was started development last year.
Around the country and he has been touched by so
many
people across the country.
You're zooming in.
Who are fighting with HIV/AIDS.
Dude, seriously, if everybody dies from AIDS, you send the cameraman to Guantanamo Bay.
Not always very good.
No.
And we have to do a better job.
Oh, well, that's not how it works. How good is your memory, right? Because you would have to get a pen. N space dash square parenthesis.
Is also very personal. You may have noticed as you arrived in the White House that we have panels that are commemorating.
Because you were taking this.
God. AIDS are worth the C, being infected. 13 national in fact. In our country,
this is. I mean, this is not gonna work either because.
As Valerie Jarrett leaves, I want to.
Because I need to zoom out. Somebody with a pen needs to write this down.
This and so many issues here in the White House and in the administration.
Anyway, I'm gonna go back and try to give it a try.
Testimony as to the importance of this issue.
Because he's not zooming out.
For her, for President Obama, for all of us.
This is, when you're giving a speech, there's no way you remember this.
So World AIDS Day.
Might as well start.
Renew and
World Congress.
Anyway, this is gonna be a little weird because I tried to find the whole thing zoomed out. Anyway, get a pen, write it down.
We're here today on the eve of World AIDS Day 2009.
N dash open square parentheses open parentheses 1s close parentheses.
We have come a long way
I could just read this, right?
in the HIV pandemic, but we have much important work left to do. I'd like to acknowledge some of the key leaders in the audience who we have with us today. First, a champion among all, Congressman Barbara Lee. Where are you?
She passed away. Wait, Dash?
Congressman Lee is chairman of the Congressional Black Caucus, and she just told me that she flew back from much warmer climates to be with us here today. She has long been a champion for people living with HIV/AIDS. We'd also like to welcome Mayor Adrian Fenty. Where are you, Mayor? Mr. Mayor, please, thank you.
This is not working so well.
Mayor, of course, of our hometown, the District of Columbia. Joining us in the audience is also Gail Smith. Gail is a special assistant to the President and Senior Director for Development and Democracy, who's responsible for global health policy at the National Security Secretariat. Gail, where are you? I know I saw you. The President's commitment to HIV/AIDS is demonstrated by the strong leadership of the team that he has assembled within his administration. And we are so fortunate today to be joined by some of the administration's top leaders in this area on HIV/AIDS. So first, we're going to hear from Secretary Clinton. Then we'll be hearing from Secretary Kathleen Sebelius. She'll be followed by the Ambassador at Large of the Global AIDS Coordinator, Dr. Eric Goolsbee. And I'm also pleased to welcome a special guest here who'll be speaking after Dr. Goolsbee, Dr. Eli Katabera, who's the president-elect of the International AIDS Society. And finally, you'll be hearing from Jeffrey Crowley. Jeffrey is, of course, the director of the White House Office of National AIDS Policy and a senior advisor on disability policy, and he'll give the closing remarks today. We have major accomplishments to celebrate, major accomplishments, but we also know that there's much work to be done. The President's commitment to fighting HIV/AIDS is personal. During the course of his career, he has traveled around the country and he has been touched by so many people across the country who are fighting with HIV/AIDS right now. He has said that we're always, not always very good at talking about HIV, and we have to do a better job of talking about it in our places of worship, throughout our communities, our organizations, our schools, and of course our workplace. My commitment to fighting HIV/AIDS is also very personal. You may have noticed as you arrived in the White House that we have panels that are commemorating AIDS memorials, quilts that are hanging all around the White House, and we also have a large red ribbon displayed at the front of our White House. And I cannot see these without thinking about the people in my own life who have lost their lives as a result of AIDS.
Really?
I watched my sister-in-law die a tragic death. I saw members of her family and her 5-year-old daughter as we all struggled with her death. I've also had close friends who have either passed away as a result of AIDS or are living with AIDS right now. So it's a very deep and personal commitment for me. We have members of the White House staff who have HIV. And as a Black woman, I also have to say that it's heartbreaking to see how many Black women are affected by HIV and AIDS. Black women have a 15 times greater chance of being infected than white women. Within the African American community that accounts for 13% of the population in the United States, almost half of the incidences, 46% of the new infections are within the African American community.
Oh, that sucks.
The news about HIV, however, is not all grim. In addition to launching the Global Health Initiative, the President has made a commitment to developing a new national HIV/AIDS strategy. This won't make every problem go away, but it does create a real opportunity to make further strides in our government's efforts to combat HIV/AIDS. One thing we know about President Obama is that he makes his decisions grounded in facts. One of the facts about HIV is that it has always been a disease that disproportionately impacts underserved and disadvantaged communities. In our country, this includes communities of color, gay, bisexual, men, people dealing with addiction, and people who are homeless. In recognition of World AIDS Day, let's recommit ourselves to increasing awareness about how to prevent the spread of HIV.
Did I watch the whole thing?
Ensure access for all people living with the disease. With this, I'd like to introduce you to Secretary Clinton. Thank you.
Yeah, so there's like a congressional meeting where everyone complained about how this one HIV drug is really, really expensive. And I went over there and told them there's a better one.
Valerie Jarrett Leaves, I want to.
It's called Lenacapavir, LENA Kappa, CAPA, and then VIR.
And for her personal
it's actual chemical. So
as the importance of this issue.
There's no way you're gonna be able to remember.
For President Obama, for all of us.
It's really, really complicated.
We are gathered on World AIDS Day to renew and recommit ourselves. It is obvious to those sitting in this audience as I look out at you and see people who have been involved in this struggle for a long time.
I mean, I guess I could just tell them. I'm going to tell you.
Made progress, but we face an unending pandemic. One that spares no one, that unfortunately disproportionately affects the most vulnerable, and which is the defining health challenge of our times. And we have to address it through a series of broad and cross-cutting global partnerships and a whole-of-government approach. And that is exactly what we are attempting to do.
$21 billion deal.
The ravages and complexities of HIV/AIDS here in our own country, and we know many of us
I'll read it, the whole thing
around the world. But we can take some heart in the progress.
It's September 18, 2025, 12:47 p.m.
Access to antiretroviral treatment in low and middle income countries has risen tenfold in the last 5 years.
It's called the President's AIDS Program or something, right?
Infections.
Let's see here. reputable. The battery. Okay. Continue with password. Okay. Password. Yeah, it should be covered. What is the HIV nuclear capsid? Oh, I'm totally doing something new. What nuclear capsid is. Protein model. The HIV nucleus is mainly built from the nucleic capsid NC, which is produced as part of the larger GAG polyprotein. During viral maturation, protease cleaves GAG, release NC as a separate protein. NC is a small protein, 55 amino acids, contains zinc, binds to zinc ions, a stable structure.
Spearheaded the creation of PEPFAR, the President's emergency plan for AIDS relief.
Hold on.
And by supporting its
PEPFAR, that's the president's.
Has made the largest effort
that's
in
the
history
thing.
By any
what is the mechanism of
a single
action?
disease. I remember well serving as a senator from New York. How there was
I'm totally misunderstanding what a nuclear capsid is. HIV capsid inhibitor, it targets the capsid protein CA, which is derived from the nuclear capsid we talked about, binding to the capsid protein. Then binds in the pocket between the capsid protein subunits at this interface of CA hexamers and petramers. Oh. The binding stabilizes or destabilizes capsid at the wrong times, interfering with normal function.
10 million people, including 4 million orphans and vulnerable children. And PEPFAR's efforts to prevent child transmission have helped nearly 240,000 HIV-positive mothers give birth to children.
Disrupts nuclear import of pre-integrated complex. Capsid interacts with nuclear porous proteins.
Our nation's investments are having an impact.
Late phase assembly and maceration inhibits the proper assembly of new capsid, producing defective non-infectious firearms.
In the fight against global AIDS with PEPFAR,
not as highly potent, has a long duration of action. Subcutaneous injection lasts every 6 months, making one of the longest acting antivirals available.
Later this week,
binds to the nuclear capsid and interferes with capsid function during both early replication, uncoding nuclear import, and later after assembly maturation, therefore blocking HIV replication at multiple stages. Yeah,
emergency response to sustainable health systems that
nuclear capsid
broad medical needs
really
of people with HIV and the communities in which they live.
Hold
in
on.
its next phase,
how
PEPFAR
conserved
will support a comprehensive whole of government approach in many countries to increase awareness,
capsid protein
stigma, and get services to
in
people
HIV
at earlier
1
stages. Obviously, our efforts are
conservative,
whenever discrimination or marginalization
the capsid HIV protein encoded by the GAG gene.
Results in
CA and kind of the gouging is one of the most conserved proteins of the virus, much more so than envelope glycoprotein. Like, oh, so not glycoprotein. I totally misunderstood what the capsid does. This is capsid.
Marginalize and criminalize and penalize members of the LGBT community worldwide. It is an unacceptable step
Jesus
backwards.
Christ. It totally is. It's a nuclear capsid.
On behalf of human rights. But it is also a step that undermines the effectiveness of efforts to fight the disease worldwide. We will also redouble our efforts to address the needs of women and girls who are disproportionately affected by HIV/AIDS in many parts of the world. Promoting the health of women strengthens families and communities.
Let's see if I can find a video. Capsid protein, highly conserved in
education.
So you inhibit the capsid protein.
Most effective health programs are integrated with functioning local and national governments. We will work with partner governments to assess capacity, identify gaps, and make customized plans to meet each country's needs.
Protein.
Now that means creating more programs like the ones that
capsid. It is a capsid.
Over the summer.
So HIV has two bodies.
Framework supports the country's HIV national strategic plan to strengthen.
It's an initiative hexamer. So
there. We visited a clinic in South Africa, which we co-sponsor with the South African government, and heard from patients who not only receive care but also support as they face the stigma associated with HIV and AIDS. Our investments in PEPFAR, the Global Fund, and overall global health have made a positive difference, and we will continue our support.
You can actually cure it.
We have to do more.
It costs a lot.
We have to make sure that our programs foster conditions that improve people's lives and in turn promote stability, prosperity, and security. In this time of very tight budgets in our own government, and
anyway,
people suffering.
There's no way, if you don't have a pen and paper, you probably wouldn't use it.
Other kinds of cutbacks in services. We have to do more even here at home. We've seen some of the results of the cutbacks that are happening at the state and local level. So while we're talking about our commitment internationally, let's not forget our fellow citizens who are suffering right now. And then we also have to make the case to our fellow citizens that our investment in dealing with the pandemic worldwide is in America's interests. So we are committed to doing so. President Obama is implementing the repeal of the HIV entry ban, a long-standing policy that prevented people living with HIV/AIDS from entering our country. The repeal will take effect early in the new year, and we will be vigorously enforcing it. Today, I am pleased to announce that with the repeal of the ban, the International AIDS Society will hold the 2012 International AIDS Conference in Washington, D.C.
If you give me the video of that, I can tell I'll get the other scientists.
This conference will draw together an estimated 30,000 researchers, scientists, policymakers, healthcare providers, activists, and others from around the world. So as we look to 2012, we have to continue to seek a global solution to this global problem. On World AIDS Day, let us renew our commitment to ensuring that those infected and affected by HIV, the woman on treatment who is supporting her family, the child who dropped out of school to care for sick parents, the doctors and nurses without adequate resources, that all those who have joined together to fight this pandemic will someday live in a world where HIV/AIDS can be prevented and treated as a disease of the past. Thank you all very much.
So we used a supercomputer to do this, and then the nuclear capsid, targeting actually used to use supercomputer to solve the structure of HIV capsid in the year 2013, May 2013. So if you use the supercomputer to solve the HIV capsid structure, you can actually
nationally and internationally, in collaboration and
cooperation between the Department of State and the Department of Health and Human Services has never been stronger. And Ambassador Gooseby, thank you so much for your great work. And it's great to have the National Ambassador here in the White House. This really is an example of the kind of collaborative effort that is underway to combat the spread of AIDS and to deal with the pandemic worldwide. We're pleased to join Secretary Clinton in welcoming back the International AIDS Conference to the United States. And I
liquid membrane and
also
protein
acknowledge
membrane.
that Valerie has already talked about Congresswoman Lee, but without her tireless efforts, this would not be announced today. I reminded her that during my early confirmation visits, the first thing she asked me was, when is that ban going to be lifted? And I reminded her that I was not yet the secretary, but I would be happy to confirm.
This is what you need to do. I mean,
take it on.
8 instrument solution.
Ban, the HIV entry ban, was a policy that tore apart families, kept people from getting tested, forced others to hide their HIV status, and forego life-saving medication. And most of all, it didn't reflect America's leadership in fighting the disease around the world. So it was fulfilling to sign the papers to get rid of the entry ban earlier this year. And that really delivers on a commitment made by President Obama during his campaign for the presidency, when he made the case that this ban had to go. So we celebrate on
use a supercomputer.
World AIDS Day this step forward. But we have to acknowledge, as we make this step forward, that we have a long way to go. You've heard from Secretary Clinton about the great success PEPFAR has had.
Oh, wow.
But we also
MacBooks
know
are pretty cool, and
places where
even 2013,
acquiring HIV,
12 years. I mean, this one's old. I mean,
so
it's 7 years older.
Our challenge will be to build on the successful interagency model we've created under the leadership of
Our computer is much better than your computers by a lot.
And that means working with partner governments to create the kind of local
even the
health
iMac is
infrastructure that we can sustain for health improvements we're aiming for. And as the head of the department that has over 1,000 employees in more than 30 countries working to implement PEPFAR, I can tell you HHS is very excited to take this next step. And I want to acknowledge the fact that we have many department leaders with us today, the head of our Health Resources Services Administration, leadership from the National Institutes of Health,
actually rather elegant.
the Secretary's office and my assistant secretary, and they're just representative of the team at HHS, eager to work collaboratively on this challenge. As big as our challenges and opportunities are around the world, we can't forget that there is a lot more work to be done here at home. According to our latest data, more than 56,000 Americans are newly affected with HIV each year. And what's more disturbing is this number isn't going down. If our results aren't changing, then our actions have to change. And that's why this summer, President Obama launched an ambitious campaign to develop a national HIV
in 2013
strategy that will reduce the spread of HIV, increase access to care, and improve.
Now I know why y'all said the AIDS thing was in 2012. The computer to do this hasn't been invented yet.
In the United States. As part of that campaign, the director of our Office of National AIDS Policy, Jeff Crowley, and my department have spent the last few months hosting community meetings around the country.
This is Secretary Sebelius in 2009, by the
Americans
way.
living with HIV/AIDS about what the components of the new domestic strategy should be. What we know is we need to do a lot better job.
Once you know the structure of nuclear capsid, you can target it and
Here in Washington, D.C.,
it is the short shelf of the virus. It's not the infection cell. It's the capsid issue.
African American men are HIV positive. And if you look at just the gay men in the community, the numbers are even more staggering. In 2005, 2005, the Centers for Disease Control found that in 5 major cities, almost half of all African American gay men are HIV positive. That's why we recently launched a $45 million HIV education campaign. It's our first federal HIV education campaign in over 20 years, and it's specifically targeted to underserved communities, including racial minorities, women, gay, and bisexual men. We're also taking steps to make sure that Americans get the care they need.
Yeah.
Earlier this year, we reauthorized
one amino
the
acid
White
mutation on
HIV
this
program,
capsid protein,
which
the
provides
virus is
life-saving
not functional
care to
anymore
more than
because
half a
it breaks the
million
hexamer.
Americans. And we'll
It
continue
won't
to
fold
work with
correctly
Congress
anymore.
to pass health insurance reform that will prevent Americans from being denied coverage because of their HIV status and because they have a cap on their out-of-pocket expenses. This World
It doesn't
AIDS
mutate, yeah.
Day, we remember those who we've lost. We look back on the lives who've been saved, and we rededicate ourselves to reaching all those affected by HIV/AIDS, not just around the
Oh, wow.
world, but here in our home communities.
Jesus
and
Christ.
in
So you
communities
could
across the
theoretically
country.
genetically
To
engineer
talk more about the announcement
nucleic
we made
capsid
today, I'd
digestion
like to introduce a
protein.
man who's been working to help people with AIDS for as long as we've had a name for the disease.
Oh my gosh.
Ambassador Eric Boosby.
It's theoretically, I do not recommend genetic engineering to make immune to. So if monkeys are immune to HIV because they digest the capsid protein. So if you add that gene into a human being, that human being will be immune to HIV. But that's genetic engineering. I would not recommend it. They made several movies about how that's a bad idea. That's a really bad idea. Making vampires. Yeah, We Are Legends, right? That black guy made a movie.
Their presence, and we value their partnership with us.
Don't do the other one, but that's so cool.
I see really more people than I can count in the
Anyway,
audience.
nucleic capsid inhibitor in the year 2022, first in class 2022, year where we sort of cured AIDS, I guess.
We had
Sort of cured AIDS, 2022.
International AIDS meeting in the
Pretty
United
cool.
States was in San Francisco.
And we couldn't do this before because we did not have the supercomputing power to visualize the nucleic
1989,
capsid.
so it has been a long time.
It doesn't have. Jimmy Kimmel
We're
taken
hoping
off
to
the
get
air.
those memories for many of you, as it certainly does for
Jimmy
me.
Kimmel is
Urgency around providing
off the air.
prevention, care, and treatment
No more
services
Jimmy
fueled
Kimmel.
by the memories of those we have lost. So many lives unrealized
Wait,
and
fifth
potentials
job.
unmet. In my
Fifth
first
job.
month in this position, I've seen the dedication of
Fifth
those
job.
who made
What-
PEPFAR a reality around the
National
world.
Security Advisor and
As those of us who spent time in
fifth job.
Africa before and after PEPFAR know, its human impact has been truly profound and continues to reverberate. It's important to acknowledge the work of President George Bush, as Secretary Clinton did, and a bipartisan Congress in creating and continuing to support PEPFAR. The American people can truly be proud of the work that is taking place and of the dedicated people who are doing this work.
Fifth
Yet
job.
it is equally true. It is equally true that the global AIDS emergency is far from over.
Four jobs. What?
Countries still struggle with vast unmet needs. There are vast unmet needs in our own country. We
Damn.
need to work harder and smarter than ever before, laying the foundation that countries can build on for the long term. Later this week, as Secretary Clinton mentioned, we'll release a new PEPFAR 5-year strategy that reflects what we've learned from the program's first 5 years.
Cool.
It will be followed by the release of annexes providing additional information and more detail on evidence-based prevention, integration of programs, increased capacity building efforts, among other topics. PEPFAR's 5-year strategy will focus on sustainability
Well, it's
and response and
it's the
sustainable
18th
responses.
now, so that's all.
Programs that are country-owned and country-driven. Programs that address HIV/AIDS in the context
the
of
rain's
broader
past
health
us
needs
now,
faced
yeah.
by people with HIV.
Raining.
Programs that build upon our successes and incorporate
Raining north.
efficiencies. Programs
Ah,
that
but that's
work
not
with
the cool part.
governments
The cool
to
part.
support
This is what-
policy change to address discrimination.
Oh yeah.
Including, as the Secretary
The
noted
second
earlier,
one.
the situation in Uganda. It will
Wait,
not
what
be an
happened
easy
in
task
Uganda?
to transition our emergency response, especially as we maintain high quality of services. But the move towards sustainability is an essential one. expand our HIV prevention, care, and treatment efforts. We need to engage with our fellow international
this is November, right?
To create a shared vision of a global response to this global responsibility. I want to offer my thanks to Secretary Sebelius for HHS's important role, as she mentioned, in implementing PEPFAR. Over 1,000 HHS employees dedicated to the implementation, evaluation, and improvement of
the dentist means
and for its action
someone
to
wanted
entry
to
ban for people living with HIV, a major step. The removal of the entry ban moves us closer to reducing stigma and discrimination associated with the disease worldwide, and is a shining example thereof. Stigma and discrimination against both people living with HIV and most at-risk populations hinder our ability to provide effective prevention, care, and treatment services.
Russian town hall.
It is important for us not only to support service delivery, but also the policies needed to remove barriers to quality and accessible care.
Russian town hall.
As Secretary Clinton also noted, the removal of the entry ban paves the way for the U.S. to host the International AIDS Conference once again in 2012 for the first time since the end of the 1980s.
U.S.-China relations.
All of us are engaged in this work, domestically or internationally. We rely on new data to deepen our understanding of the science around HIV. The International AIDS Conference is important for generating and disseminating the science.
Yeah, this is the one I
and as
saw
program
already.
implementers, we look forward
Foreign
to
policy, foreign
deepening our
relationship. This is
partnership
one
with the International AIDS
I
Society.
remember. I can't see that one
I
again.
thank you very much for this opportunity.
That
I want
agent.
to introduce my friend and colleague, Eli Kadavira, who's president-elect of the International AIDS Society.
This is around February. Not on C-SPAN. This way. Yeah. Anyway, so there's another AIDS thing in 2012.
I am honored to join Secretaries Clinton and Sebelius, Ambassador Busby, Variel Jarrett, and Jeffrey Rowley today. I'm delighted to be here for the announcement that Washington, D.C. will be the site for the 19th International AIDS Conference in 2012. The International AIDS Society is the world's leading independent association of HIV
Make sure you
with over 14,000 members.
put it on
190 countries. Our core role as International AIDS Society is to
18th or
convene
19th?
the biannual conference, international conference.
European AIDS.
The conference plays a vital role bringing together scientists, community actors, and leaders from all over the world to evaluate the recent developments, to foster debate and dialogue, and to chart course.
Yeah, how I'm watching the thing, turning the tide
pandemic.
together. Okay.
AIDS 2012
Make sure
will
you.
bring together more than 25,000 people from up to 200 countries in Washington, D.C., a city that is itself deeply impacted by the epidemic. As its president-elect of the International AIDS Society,
Okay, wait for the computers to be built.
To serve as international co-chair of the AIDS 2012, alongside with my colleague, Dr. Diane Havel, who will be the U.S. co-chair. Dr. Diane Havel is here along with other members of the International AIDS Governing Council, including our
Nuclear Capsid development. So
Dr. Giulio Montana.
saw that one.
IAS Governing Council decided to hold the AIDS 2012 in Washington, D.C., following President Obama's announcement that the United States will end the entry restrictions on people living with HIV.
Yeah. Cool.
This change is a significant victory for public health and human rights. The IAS now calls on all countries that still have similar policies that restrict the free movement of people with the HIV and AIDS through their borders to remove them immediately. On the behalf of the International AIDS Society,
It's gonna be funny.
sincere gratitude for the support
It's going back
the US
up.
government and our research and civil society partners have already shown for the conference and its aim. The IS looks forward to convening the AIDS 2012 in Washington, D.C.
Yeah, I was like, see you in 2012.
Partnership with all those working in the AIDS, in the
The
AIDS
supercomputer's not built
in the
yet.
United States and the South.
You can't image the. Anyway, so okay. So where's Hillary Clinton? The supercomputer doesn't get built until 2012, 2013.
Good afternoon. I'm
news.
Jeffrey Crawley, the Director of the Office of National AIDS Policy. So I want to take
When
one
did
quick note. Valerie
University
acknowledged a couple of people at the beginning.
University of
and I just wanna
Illinois,
add
Chicago,
one
right?
person. Within the White House, my office has lead responsibility for domestic HIV/AIDS policy, and she acknowledged Gail Smith in the National Security Secretariat. I also just want to acknowledge Zeke Emanuel, who's also
Blue Waters in 2017. It's already had Blue Waters.
So thank you. Since the inception of World AIDS Day in 1988,
Blue Waters is already in there, so
our investment in HIV prevention have produced incredible results.
Blue Waters
In the United
supercomputer
States, incidence has fallen from about 100
operational from 2013 to 2021. Use of
to about 56,000 cases a year currently.
You got the grant in 2007. You got it built in 2013. So
Excuse me.
so
Yes.
okay, Secretary, the supercomputer that you need to cure AIDS doesn't exist yet. In 2013, it'll be operational.
In
So
1988, there were no
I'll see you in
effective treatments for
2012
HIV.
then.
Well, today we have more than 24 treatments that are saving lives and extending lives.
I will
of people
see you all in
living with HIV.
2012 because
While
I'm in
developing these
2015 already.
medications
So
is important. It's equally important to ensure that they're available to people who need them. That is why the president recently signed bipartisan legislation reauthorizing the Ryan White HIV/AIDS program, which provides care and treatment to over 500,000 people living with HIV.
But anyway, you know the
AIDS in the
thing
United
you're
States.
going to target.
It's
It's
also
called the
determined to
nucleic
enact
capsid, the
comprehensive
capsid
health
protein.
insurance reform
CA
to make
protein.
insurance coverage
It's inside
more
the
available and secure
the-
for all Americans.
I mean,
including
you know
people
what the
living
capsid
with
is.
HIV.
Basically a hexamer and a
As you've
pentamer.
heard from Secretaries Clinton and Sebelius,
It's a protein that gets made really a lot, and then thermodynamics will pack itself.
With the leadership of former
So
President
it forms a
George W.
capsid
Bush,
around the
members of
RNA
both
of
parties in Congress,
HIV,
and the American public,
and if you
including
target
many in
that,
our audience today, we have made America the world's
there's
leader in
not going to be any
fighting
drug
the
resistance.
global HIV
Basically,
pandemic.
any mutations in the
PEPFAR
capsid
program and other international
renders the
efforts
virus
have given
inactive
millions of
anyway.
people access to
So
HIV
if it
treatment
starts to
services
try
where
to,
none previously existed.
basically what I'm trying to tell
And in
you,
May, President
there's a
Obama
protein you can
announced
target
his
in HIV that
administration
does not have drug
built on these
resistance.
successes
Zero
by
drug
doubling
resistance
PEPFAR
because it
funding
can't.
over the second 6 years.
The moment it
expanding
mutates
support
to
for the
try
treatment
to
of neglected
avoid the
tropical
capsid,
diseases,
the capsid
ramping
collapses
up
anyway.
assistance for maternal and child health,
So no
and
mutations
importantly,
possible in
integrating
the
these
nucleic
programs
capsid.
in order to better respond to the
That's
lives that people
survivable.
live and the health challenges they face.
So now you have a
Building the
target.
International
An
AIDS
actual
Conference
target
in the United
for,
States in 2012.
Basically,
will give us an
Gilead
opportunity to
Sciences
reflect
made
on
a
our
drug that
accomplishments
cures AIDS,
in
and they
addressing
have a monopoly.
HIV/AIDS, but also gives an opportunity
They're gonna be
learn from
super
our national
rich.
and global partners.
A drug that
The
does
president is
no
thrilled
drug
that the
resistance
International AIDS Society will hold
and
its
cures
conference
AIDS.
in Washington, D.C.
Prevents it, sort of.
And we look
sort of.
forward to working with our local and federal
I'm
partners
sure
to make this
life will
conference
find a way.
success.
And then you find
We have
another new
major
target, the
accomplishments
new
to celebrate,
capsid.
But
And
we
that
also
will
know that much work
have
remains
no
to be done.
resistance either.
So as we commemorate World AIDS Day,
Because it's
let's
structural.
recommit ourselves to increasing awareness about how to prevent the spread of HIV and ensuring access to
Yeah.
care for people living with the disease.
It
So this
can
concludes our
it
event.
can
I'd
remove
like to
the
thank you
virus
for
from
joining
your
us,
life, but
and thank you for
CRISPR
your
can.
ongoing partnership
But
with
that's
us
super
on World AIDS
expensive.
Day
Using
and
CRISPR to
every
cure
day.
AIDS is really expensive.
Thank you very much.
Yeah, we have something called CRISPR in the future. You can actually remove the HIV gene out of your body. That's really expensive. Nobody can afford it. So.
Thank you, Madam Secretary.
Yeah. Anyway, see you all in 2012, I guess. I thought I was gonna give you the cure for it. See you in 2012. I'm in 2025, so for me it's like tomorrow, possibly, or the day next week, possibly next week. I will let you know that. Yeah.